So today we're going to be talking about our surgery forms and a cage card and just what our surgery protocol is for when our patients first get here. So the patient we're going to be talking about today, his name is Finnegan. He is a Pomeranian. He's a neutered male and he's about 18.8 pounds. So that's what this cage card is. It basically, I'm not going to show you too much of it because it has our client's address and stuff on it. But it does tell you their address, their phone numbers, all the reminders for our patients, so all their vaccines, when they're due, heartworm test, the most recent blood work. It tells you the patient's name, age, he's a 9-year-old, and their ID number, their baby's tag number. So this is what we hang on the kennel they're going to be put in, waiting for surgery, and their recovery kennel, just so we know who's in that patient. So every patient that comes in always gets one of these cage cards, whether it's for surgery or not. So this patient Finnegan is going to be getting a dental. So our first form we have is our anesthesia form. We do not require blood work prior to our surgery at our clinic here. We do recommend it, but it's not a requirement. So the first question on this form is if they would like blood work. They would check yes or no. Our second is if they approve of dispensing antibiotics and pain relievers. We do let them know it's an additional cost. Obviously, we always send that stuff home. If they check no, the doctor will just call the owner to reiterate that we do have to send home pain medications for certain procedures. Our next one is if we were going to be doing any sort of biopsy, so sending off to a histopath to the lab. They would check yes or no. We will cross this section out, so for our dental it would be crossed out because they're not going to be needing to send anything off for a histopath. Our next one is if they would like us to implant a microchip while they're under anesthesia. They just check yes or no. We also reiterate it's going to be for an additional cost. And our specific clinic, we do cold laser therapy, so they can check yes or no to that. It's a 10-minute cold laser therapy session post-surgery, also for an additional cost. And then our owners will sign and check which number is the best number for them, and then it has our phone number and address at the bottom. So I'll cover up their address, but this is kind of the form that we use for surgery, so you can see all the different boxes they're supposed to check yes or no, and then we get a signature at the bottom. And so since this procedure is going to be a dental, we also have a dental consent form where they're going to fill out their name and the patient's name. And then our doctor will call the patient or call the patient's owner while they're under anesthesia if any teeth need to be pulled. So the owner has 3 options. They can choose one of them. Their first option is try to call them if they can't be reached to go ahead and proceed with any treatment no matter the cost. Proceed up to a certain amount, or don't do anything if they can't be reached. And we do state in this that they have to be called back within 10 minutes, or we're going to do whatever they mark on this form. And then same thing, print and sign. This form has no client information, so I can show the whole form. It also kind of just explains what we're doing. So that's our dental form. Since we're going to be doing our dental, what that includes would be the doctor examination prior to giving any medications. The actual dental procedure includes digital x-rays, polish and scaling the teeth, and a fluoride treatment. And then we also will extract any teeth if the doctor seems necessary. And then we have different forms I'll go over later about their discharge instructions, and those are all of our surgery forms. They do need to be dropped off between 7:30 and 8 o'clock the morning of surgery, and no food after 8 o'clock the night before, but water is okay. So we're going to be talking about our permanent records that are in our system for patients before they get surgery. So I'm going to show you using my account, so no other client's personal information is shown. So we use our Avmark as our system we use. So whenever a patient is here for surgery, we will put in our charges. So I'm showing back when my dog got neutered. So we put in all the charges here, and then over in this right-hand corner, we'll show the vaccines they're due for and any blood work and testing we've done before. So these are more of the dog's permanent records. You can go in and see any type of lab testing they've had done, their medications, anything we do here at our clinic. We do grooming and lodging as well. So you can see if they've had any grooming or if they've lodged before. So you would type in the last name of the patient and the patient's name, and you can pull up their profile on Avmark. So Shiner, when he got neutered, we did some in-house blood work. So to show you, which is our pre-surgical blood work, there's you highlight that one and then go over to the test section and it'll show both of his blood works. So it'll show his chemistry and his CBC that the doctor will look at before surgery. So you just can double click and pull that up. The machine does spit out a printed copy of it whenever we're using the actual machine, and that's what the doctor looks at, but then it also saves it onto their account. Now, if we were to do send-off blood work, we use IDEX. Again, I'm going to use Shiner, so my personal information is on here, not a client. This is kind of what that form looks like. It has our practice information with our doctor's name. It has our client ID, name, patient ID, patient name, gender, species, breed, and age. And then it'll have the requisition number when it was collected, and then it'll show what kind of testing we were doing. So this was when he had his annual blood work done. So it was just the total health profile plus a heartworm test. So that is kind of just our permanent records on our patients, including in-house versus send-out blood work. So our next one's going to be our anesthesia form. So we fill these out each day that we have a surgery. So you make sure it has the client last name, your date, your patient name, patient ID. There's also a space for the doctor's name, the tech that's going to be assisting with the surgery, if we yes or no for if we're doing pre-surgical blood work or not. And then important one is what procedure we're doing. And then it has our pre-surgical weight, our TPR, we have our age section, and then this is also a big one, precaution. So if the dog was aggressive, had a heart murmur, anything like that, we would put in the precaution section. And then we normally put our pre-op drugs right here, what we're using with the dose, how we give it, and what time we gave it. And then our induction section, we use propofol, so we will write propofol right there, dose, the way we give it, and the time. So then this next section on our anesthesia form is going to be our induction time. So the time we intubate to the time we extubate. And then as soon as we start our anesthesia, we will put the start time and end time as well as the surgery. So as soon as we intubate, we will also put that time there. And then when the doctor starts cutting or pulling teeth, whatever they're doing is when we put the surgery time. We also want to make sure we have our endotracheal tube size. We check yes if we've done a tonal trim, the catheter size, and which arm it's in. We'll also make sure to note the suture type and size, as well as fluids if we're giving them, what type of fluid. And then this is just our monitor log. So we will monitor every 5 minutes the temperature, SpO2, pulse, blood pressure. We don't do the ETCO2 here. Their fluid rate, their O2 rate, the isoflurane rate, and their respiratory rate. And then there's also more spaces on the back for us to continue if we need some longer surgery. And then our last section on here is going to be if we do any extra medications. Normally we will do Rimadyl injections post-surgery right before they wake up, so that would go here. What time we extubate, and then if anything happens during recovery, we will write it here. These are extra spaces for if we were to be putting a microchip. Our clinic does laser therapy post-surgical, so we'd write that there just to make sure we do that before the patient wakes up. And then, so there's always more forms if you need more to keep monitoring. So this is our anesthesia form. Our next form we're going to look at is our post-surgical form, our discharge form. So it tells you the patient's name, the client's name, the date, and then you can write in what procedure you're doing. It's all written on here, but we kind of would go over it with the owner. Basically, for food and water, you would feed half of a normal diet after 8 o'clock. They can have water, just limit the amount of water, and then tomorrow they can resume to normal. For elimination section, we just let them know if they have not had a bowel movement why they've been here. If they don't have one for 24 to 36 hours, it's completely normal from the anesthesia. And then we'll go over any medications we give. We'll write down what medication, and then check if they've gotten a pain injection. So normally they will all get a pain injection that will typically last for 3 days. Kind of just if we won't check that if it's one that doesn't last for 3 days. And then exercise and activity section, just limit it and limit exercise and activity for 7 days following surgery. And then confined to indoors except on a leash and for 7 days, and then you can gradually return back to normal activity. Just signs to look for, not eating for 2 days, not wanting to drink water for 1 day, weakness, depression, vomiting, diarrhea. And then if there's any sutures to remove, drains, rechecks or bandage or cast changes, we will write in the amount of days here. And then at the bottom is just saying that they need to make sure they refrain their pet from licking or chewing at the sutures or incision site, and then to just check it daily. And then if it needs to be removed or not, we will check one of those. And this is our discharge forms. So today I'm going to show you how to properly hold a patient for blood draws. So the first one we're going to do is our jugular. So since they're drawing from the jugular, what you're going to do is have your patient in a sitting position, and you're going to put your hands around their muzzle and hold their head straight up. Also, if it's a smaller dog, you can push them off of the counter and hold their legs as well, but Reggie is not small enough to do that. So again, you just hold their neck up and kind of support their head, and your arms are next to their body so the blood drawer can get the blood from the jugular. So now I'm going to show you how to hold off for a cephalic blood draw. So what you're going to do is take the patient and hug them towards you. In case they were to try to bite, you want to prevent them from biting the person that's drawing the blood. You put your hand behind their elbow, and you rotate and lift the paw up, and it occludes the vein so the drawer can draw the blood from the cephalic vein. And that's how you hold off for a cephalic blood draw. So today I'm going to be showing you how to hold off on a saphenous vein for a dog. So same thing like cephalic, you need to have a good hold on the patient's head towards your body. And you're going to take your hand kind of behind the knee and roll inwards. And that saphenous vein will pop out, and the blood draw can draw the blood from that vein. And that's how you hold off for a saphenous blood draw. Okay. So today I'm going to show you how to hold off for the 3 different blood draws on a cat. So our first one's going to be the jugular. So you can hold their head with your forefinger on their top of their nose, hold their legs, try not to cross them across the table, and you hold them upwards so they can get to their jugular vein. The next one we're going to do is a cephalic vein. So you can hold the cat next to you to keep their head away from the blood drawer, and then put your arm behind her elbow and roll off for their cephalic vein. And then our last one is going to be a medial saphenous vein. So you can gently scruff them, lay them on their side with your arm behind them for support, and push their leg up and hold down on their other leg, and then the holder will pull out the leg and draw the blood from that vein. And those are the 3 different ways to draw blood off of a cat. So today I'm going to show you how to properly take a dog out of a kennel. So what you're going to do first is open your kennel, place one hand on the patient, and then you can open it, and you want to make sure their butt is towards you. Take out the patient, and you want to keep the head away from you just in case they were trying to bite. And then I'm going to show you how to properly place him back in the kennel. You want to place them in head first, so if they were to lunge or anything, they would go away from you. You're going to place him back into the kennel. Make sure you keep one hand on the patient at all times while you're shutting the kennel to prevent any jumping. And then make sure your kennel is properly locked, and that's how you remove and put back a patient into the kennel. So today I'm going to show you how to properly put a muzzle on a patient. So first you need to make sure you have the correct size muzzle for your patient, and then you want to come from behind and then put it around their face and clip behind the ears. Try not to get their ear hair stuck in it. And then you can tighten it. If they're aggressive, you want to make it pretty tight, but still be able to put 2 fingers through it. And then you can see that it's tight enough to where they can still breathe, they won't choke. And then you can release it real quick in case they were to start to vomit or anything like that. You want to make sure you can get it off really fast. But the biggest thing is just come from the back if it is a really aggressive dog. And that's how you apply a dog muzzle. So today I'm going to be showing you how to put a cone on a patient. We're putting a cone on him because he has a laceration right here that we just sutured up. So the first thing you're going to do, make sure you have your cone put together and your gauze string. You're going to place the patient's face in the cone. Just be cautious of their eyes. Make sure it fits them properly so you don't want their snout sticking out. And then we have our gauze ties that we're just going to tie to his collar. Just make sure we tie this. And that's how we properly place the cone. So today we're going to be doing our pre-assessment exam on Smeagol. We do this exam before they go into surgery, and then we'll give them an ASA grade and see if they're healthy enough to go into surgery. So the first thing we're going to do is we're going to take his temperature and then we'll listen to him. And then we just want to make sure they're not running a fever or anything like that before we put them under anesthesia. Alright, our temperature is normal, it is 99.8. The next thing we're going to do is I'm going to listen to him. I'll listen to his heart and lungs and then get his pulse and respiratory at the same time. So everything sounds good. His heart doesn't sound abnormal or anything like that. No murmur. His respiratory was 20 and his pulse was 190. So now we're going to go ahead and check his ears, make sure his ears look okay. Okay, and then we're going to check his eyes. And then you'll also check his teeth and check his capillary refill time. Alright, and to check the capillary refill time, you just press on the gums. Alright, and then next we're going to do is I'm going to palpate him starting with the lymph nodes going all the way down to the abdomen. So we'll just turn him around. And then we'll just start up, make sure you don't feel anything abnormal. And this is just our pre-assessment exam. The doctor will also come and do their exam and make sure they're good for surgery. I just palpate everything and feel for the bladder. And then we'll also just check their back end. All right. And Smeagol here, I'm going to give him an ASA grade of 1. That means he's nice and healthy to go under anesthesia, and that's how we do our pre-assessment for surgery. So today we're going to be doing our pre-assessment exam on Louie, just to make sure she's healthy enough to go under anesthesia. So the first thing we're going to do is take her temperature. Okay, Louie. Make sure it's normal, she's not running a fever or anything like that. Alright, and Louie's temperature is normal, it's 100.1. So the next thing I'm going to do is listen to her and take her pulse and respiratory at the same time. You should make sure you listen to her heart and her lungs. Okay, so her respiratory is 120 or 20 and her pulse is 120. So now we're going to check her ears and her eyes. Alright, just make sure everything looks nice and clear. Ears look good. We're going to do our eyes next. So her ears and her eyes look good, so now we're going to check her teeth and her capillary refill time. Her teeth look good. She's nice and pink. We'll just press on the gum. Her capillary refill time is less than 2 seconds, which is normal. So now what we're going to do is just palpate her. We're going to start at the lymph nodes and work our way down. Make sure everything feels nice and normal. We're just palpating, looking for any abnormalities before she goes into surgery. The doctor will also do her own physical exam before surgery. Like I said, this is just our pre-assessment exam. Everything feels good, nothing abnormal. And I would give Louie an ASA grade of 1, meaning she's nice and healthy to go under anesthesia. So today I'm going to show you how to draw blood from the jugular vein. Our patient Kane is here just for his annual checkup, so we're having some annual blood work done. So you need your 3 ml syringe and your alcohol. I'm going to hold off his vein. I'll hold off and fill for the vein. And then we're going to spray our alcohol to help part the hair. flows, you just gently pull back on your syringe until your syringe is fully filled. And then Kaylee will hold off for the blood. We're going to place it into our red top first, about 2 mils. And you'll let it flow on its own. And then we'll put into the purple top, which has the EDTA in it to keep it from clotting. Put the rest of our blood in there. We will recap our needle and then gently invert our purple top tube to keep from clotting to mix it with the EDTA. That's how we draw blood from the jugular vein. So today we're going to be drawing blood out of our cephalic vein for a heartworm test, so we just need a couple drops. So we're going to be using a 1 ml syringe, and we're going to have my holder hold off on the vein. We're going to spray it with alcohol to part the hair. We're going to uncap our needle. Stop that video first. So once you find the vein, you'll put your thumb next to it to stabilize it. And pull back. We just need a few drops, and then Brittany will hold off. And that's how we draw blood from the cephalic vein. So today I'm going to be showing you how to draw blood off of the saphenous vein on a dog. So Marshall here is getting some blood drawn just for a heartworm test. So I have my 3 cc syringe with a 22 gauge needle. Kaylee's going to hold off. I'm going to spray his leg with alcohol. Then we're going to insert our needle, draw just a little bit of blood, and then Kaylee will hold off, and we'll recap our needle, and that's how we draw blood off of the saphenous vein. So today I'm going to show you how to draw blood off of a cat jugular vein. So we've got our blood tubes. He's just here for his annual blood work. We've got our 3 cc syringe with our 22 gauge needle. So Kaylee's going to hold our patient. We're going to hold off. Fill for his vein. Spray it with some alcohol. And then we'll just pull back our syringe until we blood, and then since it stopped flowing, we're going to place our blood into the purple top tube. And that's how you draw blood on a jugular vein of a cat. Today I'm going to be showing you how to draw blood out of the cephalic vein of our patient here, CJ. So we have our 21 gauge butterfly needle. So we have a spot shaved here, so we're going to spray with alcohol. And you can see the vein, so we're going to uncap our needle. We're going to place the butterfly catheter into the vein. Okay, CJ. And now that we have good blood flow, we're going to take our syringe, screw it to the top, and pull the blood out slowly. Just need about 1 ml. You don't want to pump it too much to blow the vein. Alright, I'm going to remove my needle, and our holder is going to hold off. And you're going to make sure to get the rest of the blood out of the tubing. And that's how you draw blood from the cephalic vein. So today we're going to be drawing blood on the medial saphenous vein of a cat. We're going to be using a 21 gauge butterfly catheter, and we have our 3 cc syringe. We're getting blood for an annual blood work to send out to IDEX. So the first thing we're going to do is have our holder hold off, spray a little bit of alcohol, and part the hair. And you feel for the vein. And we're going to uncap our needle. And then you pinch the butterfly catheter, and we're going to find the vein, release, pull back just a little bit, and And now our blood is flowing. We'll screw on our syringe and start pulling the blood into the syringe. Nice and slow so we don't blow the vein. And then we're going to try to get as much as we can to send off. We did get some blood earlier, so we just need about 2 mils if possible. Almost done. Alright, so we got the amount we need, so Kaylee's now going to hold off. I'm going to remove my needle. Okay. We're going to pull the rest of our blood out like that. And then we are going to place it into our purple top tube that we already have our other sample in as well. And that's how we draw from the medial saphenous vein. So the minimum database required for a young, healthy patient prior to surgery would be doing the PCV, which is the packed cell volume, TS, which is total solids, a BG, a blood glucose check, a BUN, which is blood urea nitrogen, and an ALT, which is an alanine aminotransferase. And those are the minimum tests you would run prior to doing any surgery, and if any of those levels were abnormal, then you can do other testing to make sure that patient is healthy enough for surgery. So today I'm going to talk about what we would do if we find any abnormalities on a physical exam pre-surgery. So one of the biggest abnormalities you can find is a heart murmur. Especially if it's an old patient with a heart murmur, you want to make sure they're healthy enough to go under anesthesia. So some additional testing we would do would be blood work. We always want to make sure we have blood work for pre-surgical patients. Some owners will decline it, but it is nice to have prior to blood work, especially if they're older. If that patient did have a heart murmur, other things we would do is x-rays and then an echo, depending on how bad of a heart murmur it is, what grade it is, which the doctor would be able to determine that. So those are that's one of the biggest abnormalities you can find, and those are some of the additional testing you would need to be done prior to surgery to make sure that patient is safe enough to go under anesthesia. So today I'm going to be talking to you about our anesthetic and peri-anesthetic protocol. So obviously the doctors normally pick all the drugs that we use for any type of surgeries or sedation or anything like that, but as a technician you should be familiar with those drugs. So we'll be talking about if we were going to be doing surgery on a 1-year-old lab. So for all of our surgeries, our doctor likes to give a Rimadyl injection, which is an NSAID, anti-inflammatory, and a pain management drug. So we would give that, she would dose that injection. For our Rimadyl, it's 50 mg per mil, so you would take the weight in pounds divided by 2 times 50, and that's the dosage you would come up with. And then any side effects from this drugs could be vomiting, diarrhea. Rimadyl's a pretty safe drug most of the time, unless that dog has a sensitivity to carprofen. That drug is safe to give and they're generally okay with it, but it's a really good drug to give to help pain management. Next, what we do, we would give that drug before they wake up from surgery. So our next drugs that we use are going to be our pre-medication drugs. We like to give those prior to putting catheters in. It just makes the dogs more relaxed, and make sure you get that catheter in the first try. So we use hydromorphone and dexdomitor. So hydromorphone is an opioid that we use to also help with pain management, and the dexdomitor we mix with the hydromorphone, and those two mixed together provide pain management and enhanced sedation. And they provide analgesia, which is just good sedation. So that is what we give prior to inducting the patient. So the induction agent that we're going to use is our propofol. So we give that prior to putting the endotracheal tube and intubating and getting them under the anesthesia gas. So we would give the propofol, and then we maintain them on isoflurane gas throughout the rest of the procedure. So that is our peri-anesthetic and anesthetic protocol. So today I'm going to show you how we record our controlled substances that we used. So this is our controlled logbook, and the drug that we used today was our hydromorphone. So we flip to the page for the bottle that we're using, and then our book requires the date, the owner's name, patient, your amount of the drug used, the rest of the balance of the drug, and then the person's initial that's making the log. So we're going to do, on our Avamark, we put in how much drugs we've used. So we use 0.4 hydro on this patient. So then we'll go and we'll enter in all of our stuff. So we'll write the first and last name of the owner. Our patient's name, the amount of drugs we used, and our remaining balance in the bottle, and then your initial. And then if you make any mistakes or anything, you just cross out. You don't scribble through, you just do one line through so it can still be read underneath for when the person who counts the drugs can go back and see if any mistakes were made and fix it if they need to be. And we do that for all the controlled substances that we use in our clinic. So now I'm going to talk about the parts and the function of our anesthesia machine and equipment. So the first thing we're going to talk about is our oxygen flow meter. So this one flows through all of these different lines, and it just controls how much oxygen is flowing at a time, and it's expressed in liters per gas per minute. Normally for our patients we leave them at 2, but this is how we control how much oxygen. You always want to make sure you turn this off after surgery, and then once you turn your gas off during surgery, once they're finished, you can leave them on oxygen while you're unhooking them for the rest of the thing, rest of the machinery, and that way they're just getting straight oxygen with no gas until you're able to unhook them from their tubes. So we have an oxygen valve right here. This is going to, if you need to get oxygen to the patient quickly, it bypasses the gas and it will dilute the gas and deliver the O2 faster to our patients. So the next thing we're going to talk about is our anesthetic vaporizer. So what this does, our machine uses isoflurane. So right here, this is where we fill it up through here, and it shows you how much is in here in this little part. So you'll put the liquid in here, and then when we turn it on, it actually turns the iso into the gas and then delivers the gas to our patient. So we use this to make sure our patient is getting the right amount of gas, as well with the oxygen, but this turns our iso in from the liquid form into the gas form. So the next thing we're going to talk about is our inlet and outlet exhalation valves. So we have our exhalation valve over here and our inhalation valve over here. So with ours, if they're inhaling, these little flaps will move, and if they're exhaling, this flap will move. We use these two kind of tubes for our machine, so I can show you with it hooked up. So some clinics have one tube with an outer tube. Ours is just the same tube, so our exhale side and our inhale side. And so these are how we deliver our oxygen and our gas to our patient. This end will connect to the tube. We will also have a bag on here. We have 2-liter bags and 4-liter bags. That will show us, we pick those based on size of our patient as well as our tubes. So our next one is our pop-up valve that we have. This is the point of exit for our gases. You do not want to keep this closed. If you keep it closed, it can build up a lot of pressure in their lungs, and that can be very dangerous. So we always want to make sure this is up. And then our next thing we have is we have our anasorb containers. This is our scavenging system. It's connected to the back of our pop-up valve. It's connected to the back of it. What this does is filters out the carbon dioxide that's going through and making sure no excess gas is getting anywhere. Our SodaZorb canisters right here are filled with our SodaZorb granules. These will actually turn purple when you need to change them. That just means it's absorbed too much carbon dioxide. And it's normally about every 30 days when you need to start changing them. So after each surgery, you just need to kind of look at it and make sure there's not a purple tint to it. And then, so this right here is our manometer. So it measures the amount of pressure that we give to our patients with our gas and our oxygen. So this button here can fill the bag, as well as this button can fill our bag with oxygen. If we're going to be breathing, so this is our rebreathing system. If we're going to be breathing for our patient, we would hold down and squeeze. We don't want this to go past 20 or 25 at the most, because then it would fill their lungs too much. We want the rebreathing system, when you squeeze the bag, to act like a normal breath that they would take on their own. Our next thing that we have here is going to be our non-rebreathing, or the banes. So when this is hooked up we will actually hook it up. We'll take this clear tube, hook it up here. And then our blue tube will go to our Anasorb canister and hook up this way. So this is our non-rebreathing system, so it is bypassing our CO2 absorber. So it will not absorb the carbon dioxide. You only use these for patients under 12 pounds. So we don't use these very often. You always want to make sure it has a closed and open valve. You want to make sure it's always open so the patient can breathe. If it is closed, it means you're breathing for the patient. And if you leave it too closed too long when they do take breaths, they won't be able to breathe normally, and this can build up a lot of pressure in their lungs and be very deadly to our patients. So that is our rebreathing and our non-rebreathing systems. So this is going to be our induction chamber, or our box. So what we would do if we had a very fractious cat or a very fractious little dog or any sort of animal that's very aggressive that we can't handle that will fit inside this box, we can place them in the box. We can lock the box. There's ties on the end to make sure the box stays closed. And then it does have the tubes on the end where you would put up your other tubes. You hook them up at the same spot. And then you can turn on your ISO and your oxygen, and also still have a bag on here. And this is going to be our induction chamber. I'm also going to grab a mask for us to look at. So we also have masks that we can use if we're having a patient that we're needing to give oxygen to really quickly. You can use the vein system, or you can use the regular tubes, and all it does is you hook up to the end of it. We can use these for really critical patients that are needing oxygen really fast. You don't have to use the ISO if you're needing to just get oxygen. You can turn the oxygen on and it'll deliver it really quickly. We have a couple different sizes of our masks. So another thing you need to monitor while you're monitoring for surgery is the respiration rate, which is how many breaths they're taking. So we have a couple different ways you can measure this. You can measure by looking directly at the patient and count their breaths, or you can look at their reservoir bag. This will inflate and move whenever they're breathing. If they're not taking big enough breaths, sometimes this won't move. So if you have a really tiny patient or a cat and they're breathing really, really shallow breaths, you may not notice this moving a whole lot, but most of the time the normal breaths they will take, you will measure by counting this. You always want to look at the patient too, just to make sure they're properly breathing on their own as well as with the bag. If this bag is not moving but your patient is breathing, your endotracheal tube may be in wrong, so you need to make sure that's inserted down into the trachea so they're getting the oxygen and the isoflurane into their system to stay under anesthesia. So biggest thing, just make sure the bag and their body is moving at the same time. So now I'm going to show you where our oxygen closet is. It is back here in our lodging. So we have this specific closet that says oxygen. Inside the closet is our oxygen tanks. The one that is currently being used has this on it, and it is currently on. So I'm going to turn our oxygen off. We're just going to turn to the right and turn it all the way. And then we also have these little things, rings on here to tell us that the oxygen tanks are full, and we can flip them over when our oxygen tanks are empty. Your oxygen tanks do have to be pinned to a wall. They cannot be just freely sitting. And then you need to make sure you turn it off every day you use it and turn it on each morning before surgery. And this is our oxygen closet. So we're going to be doing a leak test on our anesthesia machine. So the purpose of this leak test is to make sure your bag is not leaking any air, any of the oxygen or the ISO during surgery, because then that means your patient's not getting all of the anesthesia that they require. So the first thing we're going to do is open our pop-up valve. And then we're going to, when we do it, we're going to hold off. So we're going to include the end of the tube, and then we will press this, and you want it to go at about 20-25%. So I'm going to hold off, and our bag will fill up. Okay. And we're going to hold it there for about 10 seconds and make sure nothing's leaking. So since the bag's not moving, it's not going down at all, it's staying the same size, that means nothing's leaking out of it. So this bag is good for surgery. And then once you finish your leak test, you just release, and that's how you know your bag is good to do for surgery. And then the biggest thing, you just want to make sure you put that pop-up valve back to where it was. And that's how you do leak test. So today I'm going to talk about two different machines that we have. So our first one is a pulse ox reader. So it has a lead on the end of it, which for your patients, you can put them on their tongue. It reads the best on their tongue, but if you're doing a dental, it's hard to keep it on the tongue. So you can put it on their penis, their vulva, in between toes, or on their tail. So you want to make sure their saturation reading is always above 95. So you would place it, I'll put it on my finger for demonstration. It may not be able to read it just because my hand's a little cold. So you can see the bottom is their pulse, and then it may take a second to read, but their top would be the SpO2 reading. So this is 97. So if this were a patient on the table, these are normal readings. So what this is reading is the amount of deoxygenated and oxygenated hemoglobin. And you always want to make sure it's above 95. So if I were a patient on the table at 97, this would be a good reading. And it will beep if it goes too low, if the pulse or the SpO2 reading goes too low. So we have a couple different of these. This is our one that we can move around. We have one connected to our Cardell machine. It looks the same. It's got little probes you place the same places. So that's going to be our SpO2 reader. So the next one is going to be your blood pressure reading. So this is our mobile blood pressure reader. So can't demonstrate it on me because the cuffs are too small for me, but what it measures is the systolic and diastolic readings and the mean arterial reading. So this is measuring their blood pressure. So you pick cuff sizes based on the patient's arm. You're going to put it right around their arm. You can put it on a front or a back leg. Those are where you get the best readings. This little machine you will turn on and pick which leg you have it on. And then same with this one. We have different size cuffs. It's just connected to our Cardell. You want to make sure the cuff is 30 to 50% wrapped around the patient to be able to get the best reading. These are our two different types of machinery we have. Also, we have our esophageal stethoscope. This is going to read the heart rate, and some of them read temperature as well. So you just place this into the esophagus of the patient that's under anesthesia. And in a different video, I have demonstrated how these different machines work. We also can do gastric intubation, which you would take a red rubber catheter and place it down the esophagus as well to help prevent torsion or release air. So those are the different machines we have. We also will measure the thermometer. We have a thermometer we use to measure the temperature. We either have one you can place in the rectum, or we have the esophageal stethoscope that will also read the temperature. But if this for some reason is not working, you need to make sure you have a thermometer as a backup to make sure your patient's temperature doesn't get too low. So today we're going to be doing our gastric intubations. I've already measured my patients to the last rib, and that's where our piece of tape is on our red rubber catheter, and our patient is in sternal recumbency. We're going to take our catheter, and we're going to place it down their throat. And you'll place it just where the tape is, just like this. And now that we have properly gastrically intubated, we can use it to remove any air if needed and to prevent torsion. So today I'm going to be showing you how to select the proper tube size for a patient and how to do a leak test on your endotrache tubes. So to select the proper size, you can use the end of the tube or just kind of take the tube itself and put it up to their nose where their nasal planum is, right in between the nostrils. And that's where you measure. You want the tube size to be about the width of that. If you have a too small of tube size, it may move and slip. If you have too big, you're not going to be able to insert it into their trachea properly without damaging the trachea. So you always want to make sure you have 2 to 3 different types of tubes with you when you're going to be intubating, just in case one doesn't work. You've got your backups, so you can get a size bigger, a size smaller, and the size you think it is. So now I'm going to show you how to do a leak test on them. Leak testing is just to make sure there's no air leaking from the tube inflation, because if that's the case, the tube will not stay in the trachea properly, and then your patient may not stay asleep during anesthesia. So we have a little tray here with water. So what we're going to do is place our tube into the water, and then we're going to inflate our tube When you inflate, you're wanting to look for bubbles. So if you're getting a lot of bubbles when inflating, then that means your tube has air leaks in it. We are not seeing any bubbles forming. So we're going to deflate our tube. And you can still see that there's no bubbles. So we know that this tube is safe to use for a procedure, and that's how you select the tube sizing and perform a leak test on. So today I'm going to be showing you how to properly hook up our ECG leads. So we have our patient in lateral recumbency. So we're going to take our white lead and we're going to put it above his right elbow. Got that hooked on, and then we'll do the same with the left one. Put on the black one on the left leg, and then the right one goes above the knee on the left hind, and then you want to make sure you spray it with alcohol. Alright, and then so what this is measuring is the depolarization of his heart rate. So over here you can see it's reading it. So we leave this, you want to record it for about a minute, and after we record it we will actually go over what it means. So you can just see the leads reading, and it'll go up and down, and then we'll let this read for about a minute, and then we'll go back and we'll talk about it. So it's just measuring the depolarization. So today I'm going to be showing you how to place a catheter in a cephalic vein. Our patient's going to be getting spayed today. So the first thing you're going to do is shave the arm. Alright. And then we're going to scrub the arm. We're going to use chlorhexidine and alcohol, and we're going to do it 3 times. And then we're going to be using a 24 gauge catheter on her, and I already have it out and flushed, and I have our tape ready as well. So we're going to take our catheter, and you want to make sure the bevel up, and then you're going to insert the catheter. You're going to wait until you see a flash before you advance your catheter. All right, so we have a flash, so we're going to advance our catheter. We're going to hold off, and we're going to screw on our cap. Make sure our cap is secured. And then we're going to take our 1/2-inch tape, place sticky side up, and fold over our catheter. And we're going to fold our tape around. This is going to secure our catheter in place. Then we're going to take our 1-inch tape and place on top and wrap all the way around. Okay. We're also going to tape our cap in. And we're going to place another 1-inch piece of tape underneath to make sure the catheter is nice and secured. Then we're going to flush our catheter. Alright, and then now we're going to wrap our catheter with vet wrap. And that's how we place a catheter in a cephalic vein. So today we're going to be putting a catheter in our medial saphenous vein of our cat here. So she's going to hold off while we shave. And then we're going to scrub. You need to make sure you scrub 3 times to make sure it's sterile. We're going to start with our chlorohex. And then we're going to use alcohol next. And we'll do that 3 times. And then I've already got my catheter flushed. We're going to be using a 24 gauge catheter. So we're going to insert our catheter. And once we get a flash, we'll advance our catheter. Alright, once you get a flash, you advance your catheter. And we're going to screw our cap on. Alright. Now we're going to tape in our catheter. And place under the cap, sticky side up, place over, and then around the leg. We'll take our 1-inch piece of tape that's got the slit in it, place it underneath the cap. We'll also wrap that around. This is to secure our catheter in. Okay, now we're going to flush our catheter just to make sure it's in. Finish taping our catheter in. We have another 1/2-inch piece that we're going to use to tape in the cap. And then another 1-inch piece that we will place just to secure our catheter a little bit more. Alright, and then now we're going to wrap with vet wrap. And that is how you properly place a saphenous vein catheter. So today I'm going to be showing you how to do an injection IV for our patient who needs to have a sedated toenail trim. So we have our medication in our syringe. We're using Torb and dexdomitor. So my other technician here is going to roll off the vein. And then we're going to spray with alcohol. And then you want to make sure you pull back when you're in the vein to see if you get a flash. Once you get a flash, you will let go and you'll insert the drugs and then hold off. And then the patient will slowly start to get sleepy. And that's how you give an injection IV. So today I'm going to be showing you how to give a sub-Q injection. We're giving this patient Cytopoint for allergies. So what you're going to do is just pinch the skin up and you'll put right under the skin. So we're going to pinch our skin up and pull back to make sure you're not in a vein and then inject the medication. Then you can kind of hold off to make sure there's no bleeding and recap your needle. And that's how you give a sub-Q injection. So today I'm going to be showing you how to properly give an IM injection. So we are giving our hydromorphone and Dex for a pre-med for surgery. So you're just going to hold the leg right here and feel for the muscle. And then once you feel the muscle, you're going to give the injection. Okay, Diego, hold on. Pull back, make sure you're not in a vein, and inject the medication. And hold off. Good boy. And that's how you properly give an IM injection. So today we're going to be doing our cat neuter. So we are getting ready to put his microchip in and get him all hooked up to everything. For our induction process for this cat, we are using our mask instead of propofol. So we did pre-med our cat with hydro and dexdomitor about 20 minutes ago. So now we have our mask on him. It has a seal, so there's no gas escaping. So we're using isoflurane and oxygen to make sure he will stay nice and asleep for this neuter. So now we're going to be getting ready to put our endotracheal tube in our dog to intubate them and get them ready for surgery. So the first thing we're going to do is give her the propofol. We're going to be giving it at 9:08. Alright, and you want to give this slowly. And our patient had already gotten her pre-med IM before we place our catheter, so that's why we're going ahead and give our propofol. Now that we've given that, we're also going to flush our catheter. And then now we're going to intubate our patient. We do have you always want to make sure you have 3 types of tubes with you. For our patient, we are going to use our 5. So we're going to turn our light on. And our holder is going to hold the top of her mouth. So this is an endotracheal tube. So we're going to be inserting into her trachea. We're going to give her a couple more minutes. So we're going to intubate our patient. We're going to pull the tongue out. We're going to push down the epiglottis and enter directly into the trachea. And then once the tube is in, you're going to tie behind the patient's head. Make sure the tube is secure. We're going to make sure the patient is hooked up to oxygen and gas. And then we're going to inflate our cuff. We're going to inflate just enough to where the tube stays into the trachea but does not cause trachea damage. Alright, and that is how you intubate a patient. So now we're going to prep our patient for surgery. So we're going to shave for a spay. So we're going to start at the xiphoid and shave to the outside of the ribs and all the way down. You just want to be careful not to irritate the skin. You want to try to make it look as nice as possible. You want to try to get off the most hair. So we are almost done shaving. Once we're done, we're going to scrub our patient. Before we scrub, we're going to feel for the bladder and express her bladder. If she has one, it kind of feels like a balloon. Okay, so now we're going to scrub with chlorhexidine and alcohol. You call it the bullseye technique. So you take it and you start in the middle and scrub outward. You do this 3 times. If your scrub touches hair at all, you do need to discard it. And then when we're transferring the patient to the surgery room, if you do break sterility from where you scrubbed, we will re-scrub in there. So that is our 3rd scrub. So now we're going to take our patient into surgery. We're going to turn off the gas and the oxygen. And take our patient into surgery. Up to gas and oxygen. And that's how we prep our patient for surgery. So we're going to be doing CPR on an animal today. Obviously we're not going to use a live patient, so we have our stuffed animal here. So CPR is cardiopulmonary resuscitation. So the biggest things about CPR is your ABCs. So A for airway, B for breathing, and C for circulation. So we're going to start with the first step of CPR. So obviously your airway. You want to make sure you look in the dog or cat's mouth, make sure there's nothing obstructing their airway. If there is, if you can get it out, try to get it out. And then do your best to try to make sure the airway is clear. So the next thing is our breathing. So you want to check and listen close to your dog or cat's mouth to see if they're breathing, watch them breathe. You're also going to check their gums and their tongue. If their gums and their tongue are turning blue, that means that their body is not getting enough oxygen, so you need to start CPR immediately, which is where the C comes in for circulation. So for this case, I do have a larger dog. So what you would do, their dog would be laying in lateral recumbency, and you would take 2 hands, kind of like you do with a human, and your arms straight the same way, and you're going to do compressions. So you would do 30 compressions, and then you would stop, see if they're breathing. You can close their mouth but pull their tongue out and give a breath. You can give 2 breaths, and then you continue compressions. You do this for 2 minutes, and then stop and check to see if they're breathing. If they continue to not breathe, you need to make sure you have a doctor around, and then have someone to take turns with you doing the CPR, because you want it to be efficient. So if you're getting tired, especially with a larger dog, you're going to need someone to trade out with. If it were a smaller dog, you would want to put a hand behind their back to make sure to stabilize them, and then you take your hand and you squeeze like this. So you're still doing a large amount of pressure for the compressions on large and small dogs, and you're doing it right over the heart, and that's and then each time you want to go back to your ABCs, keep checking the airway in case you've lodged anything back up their throat that was originally stuck down there. So that's how we do our CPR. So you can also do CPR with an ambu bag. So what these do, these connect to your endotracheal tube. So obviously you're going to get the correct ones for the correct size patient. We have one in surgery that stays in surgery, so this is the one that's out in the treatment area that I brought out here. It's obviously not the right size for our current patient. You would have the endo tube down in their trachea, and they would be intubated already. You would, they'd be hooked up to oxygen, and then if you weren't hooked up to oxygen, you would hook this to the end of the tube, let this fill with air, and then you would start squeezing. And you would squeeze this every 6 seconds to make sure you're breathing for them manually while that person is giving compressions. So there can be 2 people doing it at once. So that is how we do CPR on a dog, and then how we properly use an ambu bag. So today I'm going to show you how to properly scrub for surgery. So I'm going to go ahead and get my hands wet. And then the first thing we have is our pick, and we're going to pick out anything out from under your nails. Make sure you get all the dirt. And you're going to want to make sure you do all of your fingers. Alright, and then we're just going to set this in the sink. Re-wet our hands. And then we've got our scrub. And then you're going to start with your left hand, and you're going to start with the side of your finger, and you'll scrub each side of your finger 10 times, and you'll do all your fingers. This whole process should take about 5 minutes. Make sure you get your fingertips. Okay, and then we'll do our thumb. Alright, and then we're going to start with our inside of our hand, and same thing, 10 times. outside of your hand. And then you'll start with your wrist on all sides and 10 times as well. And then you'll go to about your forearm. Alright, we're going to switch to our right hand and do the same thing. Alright, and then we'll do our palm. Alright, and then our wrist. Alright, and then once you're done, you'll place it into the sink and then just do your hands. And then you want to make sure you try to get the excess water off. Alright, and then we're going to go into surgery and get our towel. Alright, and the first thing you want to do is make sure the indicator strip is black and it says okay. So now that that's there, we can grab your towel. And then you'll start with your left hand and dry fingertips down with one side. You gotta make sure you get all the water off. And then flip to the other side and use the other side of the towel for your other hand. And we're patting dry. We're not going to rub the towel across our arms. We're just going to pat dry. Once that is done, we will discard that. And then we're going to take our gown. All right. So now that we've had someone tie you in for your gown, you're going to make sure you keep your hands in your gown and open your gloves. Alright. You'll take it and you're going to put your left one on first. once you've got the glove around your hand, you can start maneuvering it so your fingers fit. And then you can just adjust everything, make sure everything's good. So now I'm going to go and I'm going to open the doctor's surgery pack. So we've got our drape in here and our blade on here already. So we're going to open our surgery pack. Remove our drape and our blade. Alright. And then same thing as we did with the surgery gown, you want to make sure it has the OK strip to let you know it's sterile. So now we're going to place our blade onto our blade holder. Now that our blade is on properly, we will wait for the doctor to come here to finish scrubbing in and gowning up, and then once our patient is ready, I will show how to drape our patient. So now that our patient is on the table and ready for surgery, I'm going to drape our patient. Dr. VTHT is my preceptor. She's going to be the one doing the surgery. So we'll take our drape. I'm going to open it up. Alright, we're going to place it over the patient. Alright, and Dr. VTHT will clamp it down and cut the hole in the drape where she would like it.
Let's get some towel clamps. Thank you.
And then once she is ready for it, I will properly hand her the scalpel with the blade.
We are ready.
Alright, so I'm going to pick up the scalpel with my thumb and my forefinger and properly hand her it. And then she's going to start the surgery. So the doctor started the surgery. She will tell me when she needs me to blot. So we will wait and she will let me know when she needs it.
Hopefully we won't need much.
Okay, so I'm going to blot just a little bit. Alright, and she's going to finish her spay. So I'm going to talk about what you would do if you were to break being sterile during a procedure. So obviously if one of your gloves were to rip or it punctures, if you touch something outside of the sterile field If your gown has a hole in it, as a sterile technician, you need to make sure you take a step back away from the sterile field that the doctor is working in and have a other technician help you put your new gloves on or get you a new gown or all that things. The biggest thing is if you break sterility, you need to make sure you step away from the sterile field and don't touch anything until you're back to being sterile. Okay, so now we're going to get our patient all set up for surgery. So we have our SpO2 reader we're going to attach to her tongue. And then we're going to get the correct size blood pressure cuff for her. Alright, we're going to hook up our blood pressure cuff. Alright, and we're also going to place our ECG lead inside, and you're going to measure right to the sternum, and we'll place it inside. Alright. Then we're going to make sure we lube her eyes. Alright, and we're also going to hook our patient up to fluid. And our patient is going to be presenting for a spay today. So our doctor will be performing the spay. So she's 11 pounds. We're going to select our fluid rate. It's going to be 46. Okay, and then now our patient is set up and ready for surgery. You can see all of the monitoring. We're going to start our blood pressure. It monitors her temperature and everything. And now we're ready for our surgery. Good. So today we're going to be doing our cat spay. I'm going to be monitoring her every 5 minutes, monitoring the temp, the SpO2, our pulse, our blood pressure, our O2 rate, our ISO, and our respiratory rate. What I'm going to do now is going to lube her eyes real quick. Just put a little bit in each eye and squeeze the eye shut. Alright, and then now our doctor is going to drape the patient and we will begin surgery. for a dog neuter. She's already started the surgery, so I'm just monitoring all of his levels and making sure he's doing good. And I just monitor every 5 minutes. We monitor the temperature, his SpO2, his blood pressure, and his respiratory rate. So today we're going to be doing our cat neuter. So we are getting ready to put his microchip in and get him all hooked up to everything. For our induction process for this cat, we are using our mask instead of propofol. So we did pre-med our cat with hydro and dextometor about 20 minutes ago. So now we have our mask on him. It has a seal, so there's no gas escaping. So we're using isoflurane and oxygen to make sure he will stay nice and asleep for this neuter. So today I'm going to be showing you how to properly clean our surgery suite. So I'm going to start with our instruments. So we still do have a blade on our surgery tray, so we're going to pick up the blade. I'm going to take it and drop it into our sharps container. And then we have our instrument cleaner container in here already filled with distilled water, and it also has instrument cleaner in it. It's instrument detergent. We pour a little bit in there and let the instrument soak, and then we'll clean them. So we go ahead and do that first. So we'll place all of our instruments in there that were used during surgery. You always want to make sure there's no sharps on here first before you take anything off. We'll let those sit there and soak while we're cleaning the rest of the suite, and then we'll go back and clean our instruments. These are no longer sterile, so we're going to take them and put them in our dirty laundry basket. And then we use kennel saw to clean our stuff here, so we'll spray this and we'll let it sit while we're cleaning everything else. We're also going to make sure we get rid of any of the laundry that was used. We'll also put this in our dirty laundry bucket, and we'll spray kennel saw on this as well, just kind of all around our container. If there's any blood or anything, we also have hydrogen peroxide you can use, which you can let sit for 10 minutes. We'll also do that with our kennel saw, kind of just let everything sit for 5 to 10 minutes before we start to actually clean it. So our actual surgery cart, the first thing you want to do is make sure everything is off, which it should be since you finished surgery. So make sure your gas is off, your oxygen is off. We still have a needle on our cart. It is capped though, so we will remove our needle. And we're also going to place this into our sharps container. Then we're going to go back and we will replace the needle for the next surgery, which we have packs of needles on the surgery cart. We'll pop it open, we'll put on it, we leave the packaging on it so they know that this is a fresh needle for our next surgery. Our esophageal stethoscope, we will also spray with kennel saw. Let it sit for about 5 to 10 minutes as everything else, as well as our SpO2 reader, and spray just the ends. We will take off our blood pressure cuff. We can spray that as well. We'll let everything soak. We will remove our tubes and put them in the sink to make sure they are clean. And then we will remove our bag and just make sure you deflate it. And we'll place it in a proper drawer. And And then you just want to make sure all your cords and stuff are nice and organized. So, and then just push your cart back. In here, we don't disconnect this cart from the oxygen unless we're going to take it out of the room. You want to make sure we have a cardell here. We make sure this is turned off after surgeries, and just make sure everything's off and disconnected. This is our heating pad for surgeries. We just make sure that's unplugged. We make sure our fluids are off, which they were already turned off after surgery. And we're going to let everything sit for about 5 to 10 minutes, and then we'll come back and start cleaning. So now that we've let things sit for about 5 to 10 minutes, we've already went ahead and sprayed everything again, and then we'll just start wiping everything down. And we'll put everything back where it's supposed to go. And you just want to make sure there's no blood on anything, that everything is cleaned up. We'll clean our cuff, and then all of our cuffs have a spot on the surgery cart, and we've got trash cans at both sides of the surgery table. Make sure this goes back in its right spot. And then we're going to make sure everything on our surgery cart is also wiped down and cleaned. Okay. The next thing we're going to do is make sure both of our trashes are taken out. We'll just tie that up. And then we're going to make sure we put our heating pad up. And our heating pad is just going to live down here on the shelf with the other heating pads. And then we'll take the trash out, and that's how you properly clean and disinfect the surgery suite. So today I'm going to show you how we clean our instruments. So we're going to hand scrub them to make sure we get any blood or anything off of them that was left from the surgery. And we're going to place them into our ultrasonic cleaner. Our ultrasonic cleaner already has its liquid detergent in it with water. And when we put them in there, we will set the timer. And this just basically deep cleans our instruments before we set them out to dry and before we wrap them. It deep cleans in between all of the grooves of the instruments and everything, just to make sure they're extra clean before we sterilize them. So what we're going to do is, we've had them soaking in distilled water with the cleaning detergent. So now we just take our brush and we brush all the stuff off, make sure there's no blood or anything left on them, and then we're just going to place each instrument into our autoclave or our ultrasonic cleaner. And we're just going to make sure we do this with all the instruments. You make sure you clean all sides of them. You just want to be careful because, like, we have drape scissors in here, so you just need to be careful not to cut yourself when you're cleaning all of the instruments. We have all of our instruments in here from the surgeries we've done today. So we did a dental today and a neuter. So we have different types of tools in here from both of our surgeries. And they can all be put in the ultrasonic cleaner together. They'll just be packed differently when we start wrapping our packs. place our lid on our ultrasonic cleaner, and then we're going to turn it to the 20s. And once that timer goes off, we will set them out to dry and spray with the lubricant to prevent from rusting, and then we'll wrap our pack. So now that our ultrasonic cleaner is done with its cycle, we'll take the lid off, and we're going to start removing our instruments. Just gonna shake the excess water off and move them over to our dry towel. We're gonna lay them out, and you wanna make sure you open all the instruments so none of the water stays in and rests them. So we'll open them all up. And just be careful when you're grabbing stuff, just the same as we were cleaning, not to poke yourself on any of the sharp scissors or anything like that. So just be cautious of everything you're taking out. And we do have 2 towels here because we have multiple instruments in there for different procedures. And you don't want to let them sit in the ultrasonic cleaner for too long because they will rust if they're sitting in the water for too long. So just make sure you get them out as soon as that cycle is done and the water has cooled. It does heat up, so don't reach in there when the water is still hot. You will burn yourself, so just wait for it to completely finish. Just don't leave them in there overnight. Make sure you have everything. The next thing we're going to do is we have our lubricant for our instruments. So we're going to spray it on all of the instruments where they open and close to prevent from rusting. Alright, and then we're going to let this completely dry before we wrap them in the pack to be sterilized. You want everything to be dry. And then, because if you close it while things are wet, it will cause rusting. So once our autoclave is done, we're going to open it. And we're going to remove our pack that we sterilized. And then, as you can see, it'll have the green, or it'll tell you what surgery pack. So this is our green surgery pack, the date, the initials, and these black lines indicate that it has been sterilized and it is okay to use. Once the doctor does open it up, it does have the OK strip in it that also will need to have turned black to make sure that everything inside of this is also sterilized. And this is a properly sterilized pack. So today I'm going to be showing you how to properly wrap a surgical pack. So we have 3 surgical packs here that we use for spays, mask removals, all that kind of stuff. So I have all my instruments, my drape, and my hook towel, and my gauze. So I'm going to show you how we do it. So the first thing you're going to take is your hook towel, place it in the middle, and you're going to have about 20 pieces of gauze on each side. So just count and make sure you have 20. Alright. And then we're going to start placing our instruments on it. So we have our medicine bomb scissors we're going to place on here. We do have 2 of them. We did get some newer ones, so our doctor likes 2 of them in her surgery pack. And then we have our spay hook. We're going to have our blade holder. We also have our Addison brown tissue forceps, which are the flat ones, and then we have our Addison tissue forceps, which are the rat tooth ones. So we'll kind of place those together. And then we're going to have our needle holders or needle drivers, and they're Olsen Hagar needle drivers. We're going to place those in here as well. And then we're going to have our towel clamps. So we have 4 towel clamps that we place in here as well. And you just kind of want to have everything sitting on top, and then we will wrap it up in just a couple minutes. Now we're going to be doing our hemostats. So we have 2 large straight Rochester caramel hemostats. We'll place these in here as well. And then we have 2 small straight Rochester caramel hemostats. Place these on the other side. And then we have curved hemostats as well, 2 large and 2 small. So we also will place our drape in here as well. So we'll place this right on top. You also need to make sure you have your indicator strip in your pack. It doesn't matter the direction the arrow is facing, but this indicator strip on the arrow will turn black, letting the doctor know when they open this that this pack is sterile. So now we're going to fold it like an accordion. So we're going to take our bottom flap and push it up. Just kind of make it nice and tight. And then we'll accordion fold it. So you want to leave one little piece open so when the doctor's opening it, this is what they can grab. And then we're going to take our sides, do the same thing, just kind of wrap it tight. And then we're going to turn it around. We'll take the bottom part and then we're going to tuck it in. And then you leave one little spot out, and this is for the doctor to pull out and set out to unfold the towel so they can have their pack. So once you have the first pack wrapped, you're going to take a second towel that is going to be larger than the first one, or smaller than the first one, because this one you want the largest so they have the largest sterile field. And you're going to do the same thing. We're going to wrap it. And we're also going to accordion fold it as well. And once we've got it done, we'll tuck it in. Make sure your little flap is sticking out. We're going to take our indicator tape. This is very similar to the indicator strip that's inside the pack. This has very clear lines on it that will turn black to let you know that it's been sterilized. And then we're just going to initial. We'll put the date. We're going to put that this is our, these instruments have a red little piece of tape on it, so this is our red surgery pack. And then we'll also write on here that we have a drape in here, as well as towel clamps. And that's how you wrap a pack. So today I'm showing you how to properly wrap a surgery gown. So you want to take your gown and you want to make sure your strings are on the outside so they can grasp them when they open the gown, and you want to make sure the seams of where the arms go are together, and then you'll make sure everything matches up, and we'll place it on the table. And then just make sure everything's straight and the arms are tucked in. And then once you have that, you can fold it one more time. And then we're going to accordion fold it. And then you just want to make sure that you have the strings on the top. That way they can grab these when they open the gown. And we'll place this into the middle of our drape. And then we're also going to make sure there is a towel in there for after they scrub, the doctor or the technician can dry their hands. And you want to make sure to put the OK strip in it. If this is not in there when someone opens the gown, they will not think this gown is sterile, so they will not use it. So you always need to remember to put that in it. So now we're going to start from the bottom. We're going to fold over. And you want to make it tight so it gets nice and sterile. And then accordion fold each side. And you'll leave a little flap because that's what you will pull open without touching the inside. And you'll do each side. And then you will take the top and then you will tuck it in, and leaving a little tab out to open whenever you are ready to open your gown. We're going to take our indicator tape. You don't need a very big piece. We are going to put on there. When this is sterilized, the lines will turn black, and then you need to make sure you write what it is. I'm going to write surgery gown, the date because it will be sterilized today, and then your initials so they know who packed this gown. And then now we will put it in the autoclave, and then it'll be ready for the doctor to use for surgery. So today I'm going to show you how we pack our autoclave and how our autoclave works. So there's an insert right over here on the side where the water goes, and you want to make sure the water is in the green. The water's too low if it's in the red. Your packs will not become sterile if it's in the red. So you want to make sure you have enough. So you want to make sure our water's in the green, not the red. And then we use deionized water. Some autoclaves take distilled water. So we've already made sure this is set up. So we have a couple different things we're going to put in our autoclave. We have our surgery pack that we packed earlier. We'll just place right inside. And we've got a couple other surgery instruments that I brought too, like towel clamps and some drape scissors we'll place in here as well. So how an autoclave works is the water turns to steam, and then the steam will sterilize all the instruments. The autoclave has a bunch of buttons up at the top. It'll tell you how much it heats to, so that it can heat from 350 to 370, and it will tell you the time depending on if you're pressing pouches or packs or hand pieces or all sorts of different things. So it normally takes about 15 to 30 minutes. So now I'm going to close our autoclave. Alright, and then we're going to select our packs button. So ours is going to start out at 250 degrees Fahrenheit, and it says it takes about 30 minutes. So then we'll just press start. Alright, and so now our autoclave says it's filling the chamber. And so it'll take about 30 minutes to go through its complete cycle before you can remove the items from the autoclave. So the water in our autoclave does not turn back, the steam does not turn back into water. We do have to refill our water constantly. So you always want to make sure that level is okay. So right now our autoclave says it's filling the chamber. It will not work if your door is not fully closed, so you need to make sure your door is fully closed all the way. And then now we just wait until this cycle is over. So today we're going to talk about how to do our monthly maintenance on our autoclave. So we have this speed clean that we will use, and basically you want to make sure you have no packs or anything inside the autoclave. You will drain it and then refill it with our demineralized water, and then you put an ounce of the speed clean into the autoclave, and then you'll run a cycle, and then each time you'll drain and then refill the water, and you'll run that cycle 3 times for our monthly maintenance on our autoclave. So today we're going to be moving staples off of a surgery site. So you just want to make sure the surgery site looks good, so there's no redness, no swelling, everything looks good. So now we're going to remove our staples. Gently remove each one. And then as you remove them, you just make sure the skin looks okay, her incision looks great. There's minor scabbing, which is normal. You just want to make sure you get all staples or sutures if you're removing sutures. And then, like I said, there's no redness, there's no swelling. If there's anything like that, you may want to leave them in a little bit longer for the doctor to take a look at. But her incision looks great, and now all of her staples are removed.